Hello, I'm Glenn W. Hunter, and this with me today is Dr. James George of Excel Physical Therapy and Wellness. Dr. George, we're here again, and it's great to see you. What are we going to talk about today?
We're going to talk about shoulder pain today, and thank you for having me, Mr. Glenn Hunter. And say hi to Mr. Shaq. Hello. He's also excited to be here with us. He loves sharing his body for the medical research and medical teaching and education.
I'm glad we have Shaq with us also. It makes things a lot more clear. We can see right what's going on inside of us. And I think that is really going to be good today because we're going to be talking about shoulder pain. And that's something that affects a lot of people in a lot of different ways. So let's just jump right in. So as we're thinking about what's going on with our shoulders, what are the key areas of vulnerability that people need to be aware of?
Yes, shoulder is a very complex joint, as same like the ankle we discussed last time. If you look at the shoulder, we have a large head of the humerus and a small socket. We call it the glenoid cavity, and you have the acromion process and your clavicle attaching here, called the acromioclavicular joint, and your scapula coming from behind. So the shoulder is a very actually an unstable joint. It is not pretty stable. It is made stable by ligaments and muscles surrounding it. If those ligaments are not strong and the muscles are not strong enough, there's a chance of this getting dislocated, subluxed dislocated, and causing shoulder injuries. That's one of the problems. Or even people falling on the outstretched arm, causing fractures, causing separation of the acromioclavicular joint, fracture of the clavicle. These are typical injuries we can see in the shoulder area.
Okay. So as you're talking about some of the typical injuries, what are some of the other more common injuries that you see with regards to shoulders?
Yeah, the most common is rotator cuff injuries. There are muscles surrounding this humerus. All right, they attach to the top part of the humerus, the head of the humerus. And the rotator cuff muscles help move the arm, rotate the arm, especially rotate the arm. So these muscles can get injured easily with sports injuries, or even with work injuries, or even with falls. And the next common is ligament injuries. There are glenohumeral ligaments which are surrounding the joint. The injuries to the glenohumeral ligaments, strain or even tear of these ligaments can cause injuries as well. And fractures around the area, which we discussed in the previous question. Fractures, fracture of the clavicle, fracture of the humerus, head of the humerus, fracture of the greater tuberosity, so the fracture of the acromion. Many of these injuries also happen. So, but the quite common ones are the rotator cuff injuries, and the next common is the injuries to the ligaments.
With so many moving parts there, there's a lot of opportunity for things, really to go wrong, I guess, but obviously it works. I wanted to really focus on people that get older. I mean, as we get older, what should we be paying more attention to with regards to our shoulders?
As we get older, that is a very important question, is the posture. The gravity is pulling us down. The tendency is for people to go like this with rounded shoulders, protracted shoulder blade. Your humerus is like almost forward like this, you're hunched over. What it does is it throws the shoulder in a very bad, precarious position, the humerus. So it causes the humerus to get injured under this acromion, all right? And the muscles which are attached to it and the ligaments, they all get injured because of poor posture. And when we try to move the arm, the poor posture actually causes the injury more injury prone, right? And people, and arthritis, next one is arthritis. Because of the bad posture, people end up in having secondary arthritis.
Secondary arthritis?
which means that poor posture is causing. See, primary arthritis is it's a normal course of people getting older, ending up in having arthritis. But secondary arthritis is you have bad posture, the way you move is wrong. It is causing severe uh, degeneration. It is causing double the bad effect.
I see. I see. Wow. That kind of feeds into the point that, rotator cuffs are really susceptible to trauma. Is that the only reason? Are there other reasons why rotator cuffs are so susceptible to trauma?
Yeah, that is a very good question. See, the reason rotator cuffs are susceptible to trauma is they are kind of, especially the supraspinatus, it is one of the main rotator cuff. It goes right under this acromion and attaches to the upper, greater tubercle of the humerus. So it gets impinged, it gets frayed, it gets torn whenever people move with a poor posture and with the weakness of muscles and tightness of certain group of muscles. So yes, the rotator cuff muscle is more prone for injury, especially with performing a lot of overhead activities, fall on an outstretched arm. All of these can cause injuries to the rotator cuff muscles.
I see. As you're looking at the shoulder in more totality, what advice do you most often offer with regards to arthritis and how that affects the joint?
Yes, as I said, arthritis is a normal course of body's degenerative process. If you look at the shoulder of a 40-year-old and look at the shoulder of an 80-year-old, there's going to be a lot of degenerative changes happening in the bone. Arthritis is basically the erosion of the bone and especially the cartilage, right?
Mm-hmm.
So what we could do is we cannot completely avoid arthritis. It is a progressive nature of the disease, but we can actually slow it down by maintaining good posture, by stretching the muscles which are tight and strengthening the muscles which are weak. That way, we can slow down the process. So when you have poor posture, as we discussed the previous question, you are actually putting your shoulder in a precarious situation, causing it to have more friction, causing the humerus to jam against the acromion and against the glenoid cavity because of poor posture. So correcting the posture by stretching the tight muscles and strengthening the weak muscles would be able to help slow down the arthritic process.
Okay. So as you described the mechanics of it, I mean, there's a lot of different parts. And I was wondering if maybe we could just sort of dive a little bit deeper about the shoulder joint, the muscles, the ligaments, the tendons, the bones, and what each one actually contributes to the joint functioning properly.
Yes, the muscles and the ligaments are the ones which, as we discussed, which gives the stability for the shoulder joint. So any injuries to the muscles is going to cause the patient to have pain. Because of pain, they are moving wrong, and and it causes weakness. Because of the weakness, they end up in having impingement of the shoulder joint. All right, impingement is the shoulder is jamming against the acromion or the coracoid process. This process here. Now, a tear of the ligaments, we call it, as I mentioned, anterior glenohumeral ligaments, posterior glenohumeral ligament, inferior glenohumeral, and superior glenohumeral ligaments. All these ligaments, if any of these are torn, it causes instability. So that also causes to have impingement. Now, bones, fracture of the bones, avulsion fracture of the greater tubercle of the humerus. All of these can cause pain and difficulty with function. And there are nerves which go through this, starting from the neck, go to the back of the shoulder, the front of the shoulder. Any issues in the nerves, tightness or injuries to the nerves can also cause shoulder pain and shoulder disability.
I see. So there's also the case where you have suffering with pain going from the shoulder completely down the arm. What is going on there?
Wow, that is a very, very important question, and it is sometimes, many times, it is life-saving, especially if the pain is on the left side of the arm, going down the arm, and people are having some chest pain or jaw pain or the back of the upper back pain. With pain going down the arm, it is an emergency, and that individual needs to go to the ER or urgent care and get taken care of it. Don't wait on it. That could be because of the heart problem. All right. Having said that, many times the same could happen because of pain coming from the neck. There's a injury to the nerves coming from the neck. It could be tightness, or even just outright neck issues causing pain going down the arm. All right, so that because of that, there will be pain in the shoulder or even the elbow or down to the hand. So it is good for if you have such a pain, and if it is ruled out, it is not a. If you don't have chest pain, and if it is ruled out, it is not a heart problem. It is good to have evaluated by a physical therapist whether your pain is coming from your neck or it's purely from the shoulder. It's all about performing a thorough examination and seeing whether it is your nerves and your arms are involved, or it is from the shoulder. The pain is coming from the shoulder.
Fascinating. It's interesting how you look at the joint and how it kind of frames us, but it literally has implications throughout your entire body in terms of your overall health. So I'm glad that you're able to bring that to our attention. Talking about bringing things to our attention, Dr. George, how do people reach you? I mean, if they need your attention, how do they get a hold of you?
Yes, you can reach us calling us at 909-792-5050. Our office is at Excel Physical Therapy and Wellness in Redlands, California. You can also Google us with the Excel Physical Therapy and Wellness. You can visit our website, excelrehabandwellness.com. Thank you.
No problem. No problem. Once again, Dr. James George, Excel Physical Therapy and Wellness, and we thank you for the insight that you're able to bring to the Inland Empire with regards to, in today's case, healthy shoulders and the way it impacts your entire body.
Thank you. Thank you for having me, Mr. Glenn Hunter.
Indeed. And as always, as you're out there going about your day, be safe. We look forward to talking to you in the near future.
Thank you.